Mark Smith is a 69-year-old white male who presented to the emergency room with substernal chest pain and describes the pain as a car parked on his chest. Mr. Smith states the pain started 2 hours ago while gardening and is persisting while at rest. He reports a 2-week history of on and off chest pain, and upon admission he became nauseous and had a bout of measles in the ER. He's consented to a PCI and is currently waiting to be admitted to the cath lab. Mr. Smith is a type 2 diabetic with stage 1 hypertension, atrial fibrillation, and a history of a TIA in 2007. He has a 20-pack year smoking history but quit 10 years ago. His father died at age 62 of an MI, and his daughter is currently in town and will be staying with him on account of this event for a limited time upon his discharge. The patient is diaphoretic. He ranks his pain as an 8 out of 10 and notes feeling anxious. His blood pressure is elevated at 158/93. His respiratory rate is 21 and his temperature is 37. His heart rate is 118 and his rhythm is irregular. ECG shows sinus tachycardia and ST elevation. CKMB is slightly elevated at 10.5, but troponin levels have yet to increase and are normal at 8.2. His hemoglobin A1C is 9.6%, and his most recent blood glucose was measured at 202. His serum creatinine is elevated from 1.2 a month ago to 1.6 today. According to a list provided by his daughter, his current home medications include aspirin 325 milligrams once daily, simvastatin 40 milligrams once daily, metformin 500 milligrams twice daily, diltiazem 240 milligrams once daily, multivitamin 1 tablet once daily, loratadine 10 milligrams once daily, and over-the-counter ginkgo supplements 120 milligrams once daily. Upon admission, the patient received nitroglycerin for 3 doses, chewed aspirin 325 milligrams, and morphine 5 milligrams IV times 1 dose, but did not attain pain relief. The patient is currently receiving nitroglycerin drip at 10 micrograms per minute, and it began 20 minutes ago. The daughter also alerted us to a possible codeine allergy, which she describes as itching in nature. We suspect a pseudoallergy. At this time, we recommend close monitoring for signs of anaphylaxis. If the patient can't tolerate his morphine side effects, administer diphenhydramine 10 milligrams IV for 1 dose, or another option, we could discontinue the morphine and administer fentanyl 75 micrograms IV bolus and initiate a continuous infusion of fentanyl at 75 micrograms per hour, and we want to titrate that to adequate pain relief. The patient is scheduled for PCI, reperfusion therapy, and should initiate antiplatelet and anticoagulation therapy. We recommend clopidogrel, a loading dose of 600 milligrams, and a maintenance dose of 75 milligrams per day for the duration of his hospital stay. For anticoagulation, we can do unfractionated heparin 5,250 units IV bolus and supplement with IV bolus doses to maintain a target ACT of 250 to 350 seconds. Continue monitoring his APTT levels every 4 hours after the first initiation, and continue for 48 hours or until the end of the PCI. If the nausea and vomiting persists, consider ondansetron 4 milligrams IV times 1 dose given over 2 to 5 minutes. Pending patient stabilization post-PCI, we should initiate maintenance anticoagulation therapy and adjust his current home medications. For his diabetes, we recommend continuing his metformin PO 500 milligrams twice a day and adding on pioglitazone 15 milligrams once daily. Both of his medications do not affect his renal function. The A1C goal is less than 8%. For his hyperlipidemia, we recommend continuing simvastatin 40 milligrams and to continue and to monitor the patient's lipid panel. The lipid panel goal is triglycerides less than 150, total cholesterol less than 200, HDL greater than 60, and LDL less than 100. For his hypertension, he's currently taking diltiazem 240 milligrams daily. We recommend discontinuing this and adding on metoprolol 25 milligrams twice a day and titrate as necessary to control his atrial fibrillation. His blood pressure goal is 130/80. In addition, we recommend bridging unfractionated heparin and warfarin 5 milligrams by mouth once daily in treatment of atrial fibrillation with an INR goal of 2 to 3. We also counseled the daughter on discontinuing use of the over-the-counter ginkgo supplement for its risk of causing bleeding, and we just recommend a follow-up conversation with the patient about that as well. Thank you.